So I'm calling the meeting to order. We've got a quorum established and we all know each other. We don't have any guests in the audience. Where's Penny? Is she on? Oh, okay, my bad. We do have
I'm here.
a guest. Penny, can you introduce yourself? And
yes, Penny Everest,
thank you.
Executive Director for Park County Senior Coalition.
Great. And I know we have spoke on the phone several times when I was at Daybreak. So welcome. And I look forward to meeting you someday in person.
Me too.
Great. All right. Now, do we need a motion to approve the agenda as written?
Amy Mitchell, so moved.
Thank you, Amy. Do we have a second? Mary is giving the second. All in favor?
Aye.
Aye.
I see head shaking. I think we're all in favor. Agenda is approved. Approval of the minutes from the December meeting. We need a motion to approve those as written.
Amy Mitchell, I move to approve the December minutes.
Thank you, Amy. Is there a second?
I'll second.
Thank you, Dayton. All opposed? None opposed. They're approved as written. Thank you. Jared, are there any public comments for the meeting today?
So, Madam Chair, I will ask that anyone who is online who is not a member or staff or presenting to please use the raise hand function on Microsoft Teams. Let us know that you would like to provide public comment. While we are providing an opportunity for people to find that function, I would just let the commission know that we did not receive any advance requests for public comment, and we did not receive any written public comment that we would distribute to the commissioner members ahead of time. As I have gone through that, I have not seen any hands go up, so I believe we can move forward at your discretion.
Great, thank you. Next is agenda item 5, action items, and Aaron is not here, so we are moving on the vote to our newest member, Penny Everest, to vote her onto the commission. And Penny, you want to give us a little bit more background about your work with seniors and why your interest in serving on the commission?
Well, I first started out as a program manager, and I realized how much need was needed in Park County. And then after Jenny had moved on, I became the executive director. And I'm very, very fond
Penny, this is Melissa.
Yes.
I'm going to interrupt just for 1 second. At least here in the room, we're not hearing you very strongly. So if you could lean into your computer and speak a little bit more, at least for us here, that would help us a lot. Thank you, Penny.
Okay, very good. I was the program manager about a year ago, and starting with the Park County Senior Coalition. And I really found that the seniors were really great to work with and had so many needs, and I was able to help them by becoming a program manager and using the various programs that we offer for them. And then when Jenny moved on, I was able to become the executive director, and I can't believe how much opportunity I have now to help the seniors that are out there in all of Park County. And I'm hoping that in getting this membership, this will help me further my goal of helping these folks.
That's great. Thank you, Penny. So now we need a motion to vote Penny onto the commission.
I'll make a motion to vote Penny on and to the commission. And I'll just also with that really quickly, Penny, just really looking forward to you bringing your perspective on board and just learning what you're seeing there in Park County at the Senior Coalition and bringing that here to this group as we take steps ahead. So thank you for putting in your application. And after reviewing everything, I make a motion to approve. Thanks.
Very good. Thank you.
Thanks, Dayton. Would someone like to second that vote on Penny's?
Amy Mitchell, Madam Chair, I second the nomination of Penny Everest to the commission.
Great. All in favor, please say aye.
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 The ayes have it. Welcome, Penny. We're excited to have you aboard.
Wonderful. Thank you very much for this
Yeah.
opportunity.
And we will be scheduling an orientation for the newest members of the commission. And Melissa will schedule that, and it will either be in person or hybrid, whichever is most convenient. And we'll get that on the calendar within the next month.
Sounds wonderful. Thank you.
You're welcome. Moving on to information items, the membership committee. I don't know if Aaron gave you a report, Melissa, but Aaron was not able to attend today's meeting.
I can share a little bit. Again, Aaron is our newly engaged membership committee chair. We are glad to have that glad that that fell into place when Paula stepped into the chair role here. And she is working diligently to bring on some new members, specifically really focusing in on getting folks appointed from the PPACG jurisdictions. And Jody and I are working on an outline for kind of some best practices for doing the appointed jurisdiction work. Every jurisdiction does things a little bit differently, but regardless of that, there are still some kind of things that can be looked at and thought about as Aaron jumps in to kind of finish this process, both in Woodland Park and then also in Green Mountain Falls. So hopefully within the next 3 months, we will have some appointees from those two areas. So kudos to Aaron and also the rest of the executive committee who work really hard to talk about membership and where to bring people on from. So stay tuned for more from those two areas.
Great. Thank you, Melissa. Next, we're going into the policy committee reports. And Commissioner Mitchell, do you have a report for the Colorado Center on Aging?
Oh, yeah. We did not have a meeting this week due to Martin Luther King holiday. And the meeting before that, legislative session had not started yet. And so we just discussed mainly housing, what bills were going to be brought forth about housing, how to have some of them have some focus on seniors, senior housing. I think that I think standard build that incorporates how do we say it, structure for seniors. They're trying to get a bill passed that would require new housing, 10% of the housing be set up to where it is easier accessibility for seniors with regard to, you know, stairs and all the other safety features, but nothing has been drafted. Talked about land use and some of the things they're looking at to change on land use to be able to promote housing and what we will do to help with some senior focus. So that's it. I think next week we will have a meeting and it's off to the races. So that's all the report I have for this month.
Great. Thank you so much, Amy. Appreciate it. And I can't see if Commissioner Sorello-Smith is on. She is not, so we do not.
And what I'd like to do, I know Jared included in the packet some information on what's been being talked about at the state level right now. Kathy also forwarded the same information from her CCOA meeting. And so I'm wondering if either Jody or Jared wants to just jump in and talk about some of this stuff right now, because Kathy would have probably referenced some of the same material, because again, she forwarded information to me, and then it turns out that Jared had actually already put it into the packet for our commissioners. So thank you, Jared.
Yeah, this is Jody. So I think actually kind of the next 3 points are going to kind of intersect. So I can see Melissa and Paula there. So Jared, I apologize if I'm speaking over you, but oh, there you are. Great.
You're more than welcome to go first, and I can follow, or vice versa.
Sure. So let me kick it off and share what's been going on. It's been fast and furious and really exciting, actually. So what you can see there on the screen is Senate Bill 24-40. This has actually been sponsored by Senators Danielson and Janal, as well as House sponsorship from Representatives Wilford and Mary Young. This is really exciting because it's not just a single pathway toward increased funding for senior services within the actual state budget. Many of you may be familiar with hearing me talk about Older Americans Act. That's our federal funding act. Older Coloradans Act is our state level funding act, but the actual budget line item within the state of Colorado budget is called the State Fund for Senior Services, SFSS, and that does not roll off the tongue easily, I will tell you what. But specifically within that line item, we have both a bill proposed, the Senate Bill 24-040 from Senator Danielson, which is a three-part bill. First would be a one-time flat increase to the State Fund for Senior Services for state fiscal year 25-26. So that's our upcoming state fiscal year. Second part of that would be an annual increase tied to inflation. And the third part of that would be a triennial review for confirmation that the funds are sufficient. We already know they're not, but the nice thing is that this actually puts a tool in place for the state, what they call the department here. That's the Colorado Department of Human Services, Aging and Adult Services, which is our state administrators, as well as AAA. So we are named within this bill as being part of the triennial review. And so this is a three-part. It'd be a $5 million transfer from the general fund to CDHS and the State Fund for Senior Service. That's really exciting. The other part that's going on is Colorado Department of Human Services back in December provided their regular update and budget request to the Joint Budget Committee, or JBC. And in that, the JBC requested give us a dollar figure. We know we know services are being challenged right now by the needs, and the Colorado Department of Human Services had to go away from that first request to work up an estimate to respond to the JBC. We were very fortunate to be part of that conversation as they are working on that number. There is no specific number set aside quite yet. That's still in process, but it could be at least that $5 million. It might be a little bit more. And keep in mind, these are one-time budget adjustments. They're not ongoing. And so we're really excited to know that there are actually two possibilities The Joint Budget Committee may defer to the bill process, or Senators Danielson, once this gets into committee, may defer to the Joint Budget Committee. We just don't know how that's going to play out. The letter that Jared is showing here is really exciting because we are a quasi-government entity made up of 20 members across 16 municipalities across our 3-county area. That's a long way to say everything we do is complicated. There are certain steps that have to be taken. I can't just march on Capitol Hill and say we need extra money or additional funds. It just doesn't work that way. Those of you I've worked with before know that I would do that in a heartbeat, but there are certain steps that have to be taken now. But I'm just really excited to share that this letter that was made part of your packet was approved through our board of directors at the most recent board meeting in early January. In fact, just last week. What has happened is this is providing support to either response to the need for additional funding. So whether that is increasing the appropriation to the State Fund for Senior Services, which is what the Senate bill would do, or through the Joint Budget Committee process, which is the one that the JBC members asked the CDHS staffers to go back and sharpen their pencils and give them a number to be added to the budget. So this letter basically is just advocating for a positive result through either one of those options. The discretionary funding right now is a little tight. There's only about 25 million available to be split out. We are just one of about 25 or 30 organizations within the state structure requesting additional funds. 5 million would be great. It's not nearly enough to truly make up the shortfalls we're experiencing right now in services across all of Colorado, but it's a good first step. And so this letter from the Pikes Peak Area Council of Governments Board of Directors simply is showing that you have 20 members of the 16-member organization who unanimously, and that's crucial, unanimously are advocating and supporting the additional funding conversation. So we're really just tickled that this is happening. If you could scroll up just a touch for that upper paragraph, Jared, one of the ways that we're showing the shortfall is just explaining that in our most recent carryover funding. So state funding has to be used within the state fiscal year. You don't have a second shot at it. So we spend that first. That's our priority spending funds. Federal funds, though, have an extra few months to be used. And so once those are determined, those come back into our region. This year, our carryover funding available to senior service providers, was $145,414 and some odd change. The challenge, though, when we reached out to our current contracted providers with current contracted services, the needs showed back in requests of $839,228. That's a difference of almost $700,000, meaning that the needs are far outweighing the actual available funding. And so this is just one of the ways that we are sharing our story of the need across our 3 counties. So we're really excited. There's just very, very positive push towards additional funding for senior services, either through the bill process or the JBC process. We have this additional advocacy from our own region, the municipalities, and these are all mayors and commissioners and city council members. They're all voting in voting unanimously to support these efforts. You can see that this letter went to all of our local representatives, as well as and senators, as well as those on the JBC. And so I am actually sitting in Denver this afternoon. We will be hosting, you all should have seen the caucus invite by now that went out just a little bit earlier today. There is a legislative caucus on aging tomorrow morning here at the Capitol, and we will be sharing more details about the needs for the additional funding for senior services. There is a Zoom link if you're available. You want to just call in. We'd love to be able to show Senator Janal and Representative Young, who are the co-hosts for this legislative caucus on aging, just the support that we have from our region. So would invite, if you have any questions, let me know. The specific topic is this additional funding. There will be 3 more legislative caucus on aging through the legislative session, who will have different focus and different sponsorship. So I am available to answer any questions. Jared, if you have anything you want to add to that, please jump in.
The only thing I was going to add was for Senate Bill 2440. It does have a committee hearing date, January 25th at 1:30 with Senate Health and Human Services. That is 1:30 p.m. on the 25th.
1:30 on the 25th?
Yep.
Thank you.
And as a reminder, and Jody knows this probably better than anyone, just because it's today on the 25th at 1:30 p.m. doesn't mean that tomorrow it won't be on some other date. Still probably at 1:30 p.m. because those committee times usually stay the same. But I would definitely write that in pencil with an eraser.
Jody, thanks for that information and sharing so thoroughly about what's happening. Does anyone have any questions for Jody?
Who sponsored the senior caucus again? Who put that all together?
Sure, that's Janal and Young. So Senator Janal and Representative Young, and they are also co-signers on the SB 24-40 bill, along with Senators Danielson, she was the author of it, as well as Representative Wilford. We also have Representative Stephanie Vigil out of Colorado Springs, who is has already talked. She's already reached out to me to confirm that she's going to be speaking with Senator Danielson about becoming another co-sponsor. So the more names we have on there, the better. We're really excited about this.
Is there ever a need for more letters to be written, and could other agencies or could our commission write a letter to help support that cause?
Yeah, so let me split that out actually. So because we have received the approval from our board of directors to continue to advocate this, we can work on formulating a letter from the commission to this end. So thank you for asking about that. Had they not, or if it had not been unanimous, or if they had had any kind of hesitation, that'd be a whole different conversation. But because they have provided unanimous support for us to continue to advocate, then I think we can formulate a letter. The other side of that, though, is our friends here in the Denver Regional Council of Governments. For those of you who may not be familiar, that's DRCOG. That's not a person, that's an agency just like ours. But DRCOG has put together a wonderful toolkit, which we're going to be sharing out. And Paula, since you've asked, we'll make sure that all the Commission on Aging members receive a copy of that toolkit, and it's all about advocating for additional funds. It shares the shortfalls, the challenges, the folks who are going without services, what that really looks like, and then additional information for follow-up. So in that, it can be customized either to your agency name and a contact information. You can put your agency name and put my name as a contact, to answer those questions, whatever that looks like. So we're going to be sharing that out here very soon. So be watching for that. But that would be a perfect opportunity, because the more I will say, the reason and part of the process when JBC was talking to the Department of Human Services back in early December, they stated, we are hearing from organizations, providers, and stakeholders that people are going without services. We want a number. Give us a number. What does that increase need to look like? We can't wait. If you don't come up with a number, we will. All very positive. I would not have wanted to be the one sitting in that hot seat that day. But at the end of the day, we saw just wonderful support from members of the JBC directly responding in that committee, in that format, to the fact that they had already been hearing from folks around the state, either providers or direct recipients, that services are being cut, services are being lessened, and increases are necessary. And so letters are always good. You can do whatever you need to, whatever you want to as a private citizen, as a private business or organization. But like I said, we're very happy to help by sharing this toolkit that's in process. But at the end of the day, as a private citizen, you go for it. Do whatever you want to, as soon as you want to. You want any language from us, we are happy to help. We just have to be very careful anytime it's a PPACG, PPAAA, or a committee, commission, subgroup like you all. So
great. Thank you, Jamie. Amy Mitchell, you have your hand up.
Thank you, Madam Chair. I have a question for Jody. Jody, if I can arrange my schedule, I know that there's always a strategy about how many people testify at a bill. You don't want the committee to get too overloaded, but I could find time to, if I can find time to testify next week, do you have all the seats filled? I do it as a county commissioner, not as a COA, Commission on Aging member. But do you have them all slotted, or do you need a couple extra?
So we don't have anything slotted out specifically, and that really doesn't fall to us. That is up to the specific committee as to how many people sign up versus how many they will actually allow to testify. So as soon as, and Jared may be able to answer this, Jared, are the signups already available for testifying on the 25th?
I've not looked that far quite yet.
Okay.
I just looked in to see if they had scheduled a committee vote. Yeah, the nice thing is we've got roughly a week or so.
Right.
Yeah, normally, Amy, to your question, what happens is anybody can sign up. They can, what you do is you register to, and I'm saying, I know you probably already know this. I'm saying this for the benefit of the others, but typically what happens is there's an online registration. You register who you are, if you're representing an organization, what the topic is. And a lot of these are drop downs built into the testifying system. You get on that list. You're then able to watch and listen to the testimony ahead of you. Depending on what other bills are before the committee does have the authority to say, we're running out of time for this next bill. We're only going to take the top 5 or the top 10. Or I was testifying a year or so ago, and there were nearly 30 people on a bill registered before ours. We were testifying for the homestead exemption bill, and whatever the bill was in front of ours, there were around 30 people signed up, and they said, for sake of time and how many bills we still have to go through, we're only going to accept on, I think they said 8 or something like that. And so they will really just randomly call the first 8 people that they come to on the list. Doesn't necessarily mean because you signed up early you can have that opportunity. So it's important to be registered and to be prepared, but there's no control beyond that. But yes, as a private citizen, whether you're representing discussing the needs, especially in Park County, which of course you could speak to quite eloquently, or eventually, when we have time and we can get more broad advocacy approval, that could be an option as well. So,
Right.
as soon as we know more, though, we can share that out.
And Jody and Commissioner Mitchell, I just looked up and you can sign up for the bill topic and everything else like that.
Okay.
So right now we've got 3 bills scheduled for that particular committee meeting. One of them is not an aging specific issue, but it is one that'll likely be PPACG issues. So 2 to 3 bills I will personally be looking at closely in that committee.
Okay, thank you. Yeah, so I'll go ahead and set aside that time since I have the direct approval to advocate for that bill. So I'll go ahead and get registered as well. If you can point us in the right direction, that'd be great.
Great. Are there any more questions for Jody or Jared? If not, everyone can sing happy birthday belated to Jody to themselves, because I don't think it would be in sync if we tried to do it hybrid. But his birthday was January 11th, and I just want him to know that we acknowledge it and we wish and hope he had a very happy birthday.
Oh, thank you. That's lovely. I appreciate it.
You're welcome.
That. Yes, I finally qualify to go to the senior center.
Good for you. Good for you. Okay.
So
Commissioner Mitchell, do you have, I'm sorry, go ahead.
I was just going to say, I think the only other thing is I will ask Jared to give a kind of a broad update as to the legislative committee and steps that have been taken. He's got a kind of a master list of some of the potential bills. And I think that's even, there may be even some newer information since the last legislative subcommittee of the PPACG. But from there, I don't have anything new to add to my 6C agenda item. Thank you, Madam Chair.
And Amy, if you have anything to add, also feel free to follow up with Jared's comments about the legislative committee.
So I will just say, so far out of, oh gosh, I'm trying to do this off of memory, and that's already a bad thing to rely off of. There's probably what I think it's like 150, 160 bills and resolutions already introduced. Of the look, last time I went through on Friday afternoon, there was about 40 that looked like had some potential tie to a PPACG issue, not just aging, but also military, transportation, air and water quality, in addition to aging. There's also some other issues that our board likes to take positions on. Those usually have to do with local control issues, as well as mandates. And so there are about 40 bills right now. The committee will start meeting, and Commissioner Mitchell, you're going to invite on this. But they'll start meeting starting, at least we'll block it out weekly, starting on Mondays at 8:30. Whether we need to continue that cadence early on, I don't know, but that first meeting is just going to be looking at all the bills. Is this an issue we want to look at? If it is, do we monitor, do we support, do we oppose, and look at it that way. So that's pretty much the extent of the legislative committee. The session is a whole 1 week old right now. And it's already, I was watching the sessions I missed. There's already been calls to read bills at length. So this could be, and that stuff didn't come out until probably March or April last year. And that was the 3rd day of the session. So it could be an interesting session for us to be monitoring. 150, 160 bills is, I think we're through the initial rush, and then we just got to get everything up to speed and then prepare for the end of the session rush come late April, early May.
Great.
Thank you, Jared. I will plan on attending the legislative meetings on Monday mornings. I get a lot out of it, and I'll put in my effort as a county commissioner to help however I can. Thank you.
Thank you.
So now we can move on to chair reports. That would just be me. And Melissa's whispering in my ear, that would be whatever I would want to say. And I don't have much to say. So we'll move on to 7A. Yeah, we have a very full agenda, so I'm just gonna keep going. So Dayton, how am I doing? Are you still there? Anyway,
Yes, I am. You're doing fantastic, Paula.
Okay, great. I'm trying to live up to your expertise. So strategic planning, 7A, goals, objectives, tactics, measurements. We plan to bring all of these to a formal vote in February. Those were the things we broke up into small groups and came up with ideas and collaborations and what we wanted to move forward with, the priorities from our community meetings and what we came up with in our small groups. And I know the group that Amy and Connie and I were in, were talking, we bit off a big bite of the elephant and want to take on a caregiver conference. And I think it's very doable. I think we just need to get that first meeting under our belt and get rolling on it. I myself love to plan events like that. I'm all over it. So I do think it's doable. If we can pick a date and a venue, I'm all over that. And I know Connie's got a new baby boy coming her way in the next month and a half, possibly, or sooner. So we'll talk offline about that. But I think if we kind of get a committee going, and it doesn't just have to be, it can be people in senior care around the El Paso County, even Teller County. I think we could get a good group together to get a good conference, initial conference set up, and hopefully it become an annual event.
And so I'm going to jump in a little bit here too. The committee, like, we broke up a couple meetings back into the 4 different groups, and everybody has forwarded to me their notes that they did while they were in those meetings. And the hope for today is for us, because I have tried to kind of distill down the minutes that people took, but I'm just not really sure that I'm going to capture things appropriately. And so for about the next maybe 45 minutes or so, and maybe less, I was hoping that we might be able to look at each of the goal areas, and we could start with the caregiving one that Paula just brought up, to just really kind of be sure that, how does the commission want to be tracking this? Because we've talked about, do we want to have tactics that are going to be for 4 years, or do we want to have the tactic for the upcoming year? And, what might that look like? And because I think that each group, some have like a broader timeline, some groups a 1-year timeline. And I just want to try to get not everything down onto one sheet that kind of, is comprehensive about what's happening, but at least kind of get maybe a general foundation and a general look that's the same for all 4 of the goals, because right now everybody's stuff just looks really different. And so maybe kind of, for example, with Dayton and Aaron with age-friendly housing. So maybe Jared, if you could pull up the age-friendly housing goal number 2 on here. So, these guys, kind of really were, I'm not sure, Dayton, if you guys were looking at kind of a 4-year, I think you kind of were, but you really did kind of break down into 3 core kind of tactics, and then had, some kind of specific things underneath each of those core tactics. And so that looks very different from, kind of how Amy and Steve had tackled the conversation around enhancing accessible and affordable healthcare, and even with the caregiving piece. And so I just kind of wanted to see if there's a way, I guess, first of all, for us to determine, do we want to target 4 years? Do we want to look at 1 year? Maybe some do have a 4-year outlook, but maybe some only have a 1-year outlook. I even know, like with the caregiving one, the group talked about 1 year, but yet would want to do, a conference every, each year for the next 4 years. So it is kind of a 4-year thing. So I'm going to kind of just pause there for a second and let Dayton and Paula maybe throw out a couple of thoughts about this, and then we'll kind of go from there.
Dayton, you want to go or you want me to go?
Sure. So the format that we had followed for goal 2 was just kind of in part recognizing that this whole sort of strategic plan aligns with the CASOA data, right? So that's where we're getting the 4 years from, and that we're trying to move the needle on some of those percentages that are being seen in that area after 4 years, and hopefully some of these tactics lead to that ultimately, right? It could, I think, look different and in terms of like how we get there. So first year we might establish those relationships, second year we might go on that education campaign, and then third year we look to facilitate the adoption of policies. So it could kind of build in that way. And I also just want to recognize that 4 years is a long time. And so just recognizing that these are dynamic types of plans. And if we just set out with this, just this vision in that we're trying to, this is what we're trying to achieve, right? This is the main outcome. And it might be this zigzag in getting there. But this is kind of what we're coming up with for now. And I do think of, again, I'll just go back to our template here. You'll notice under our, under those highlighted portions, those highlights are tactics. And then under that, we have like, what are the resources needed in order to do that tactic? And how are we measuring ourselves that we're being successful in that tactic? And then what is our timeline? And our timeline is, we're going to continue to build those relationships throughout the 4 years. Like that is just an ongoing thing throughout this plan. And the second one is the same sort of format in that it has the tactic, the resources needed, timeline, and how we're measuring progress or the success of the tactic. So that was kind of our approach, and I don't know if we want to kind of similarly go through the other goals and answer those questions, or if that to me might be a first step of like, let's look at the other goals and see how they fit into those formats. Or if they don't, then that's cool too. We could figure out a different format. I'm not married to anything, but that was just our tack.
I like your format of that. I think because the topics, the categories are so different, if we have a common thread through our tactics, I think that's enough. I don't think we need to follow the same template for each goal because they're different. They're individual and they're going for different senior issues. So one thing we talked about with our caregiver thing is that we would have a conference survey at the end of the conference. The attendees would fill out a survey. And then the next year it would be, is this your first survey or have you attended, did you attend last year's, or how many years have you attended this caregiver conference type thing? And then ask questions about, how much they have gotten out of this and what, just ask good survey questions so we can get good information to enhance the next conference. So I think as long as there's a common thread through the tactics, I think that's just my opinion. I don't know what everyone else is thinking. I think it'd be really hard to put each category into the same template, but everyone else can chime in too.
And I have the document that's on the screen in front of me in paper form. And so I am kind of taking a closer look. And, Jared, if you could scroll to the caregiving support one, which is a goal number 3. Perfect. And so there's a lot of good information on here. But what I can focus in on is pulling out, we've got the tactic listed, which is actually doing a family caregiver conference, which I don't think it actually says that there, believe it or well, it does. A little further down, create a caregiver conference for the Tri-County area. So the tactic is creating the conference. And then I can dig through this and look for, the resources that had been identified. And just because not all the resources are identified today there's, that's part of the whole work is identifying all the resources. So there could be a lot more resources that get identified. And then as Paula already mentioned, the measuring of success is doing the survey. So like for this one, I think we probably have it covered with that information. So then
and Melissa, if I may, so just for like clarity's sake, one, I believe that is an amazing tactic in order to accomplish strengthening caregiver support and services. I think in that survey, if I could make a recommendation in that it has comparable language as the CASOA, so that we are kind of comparing apples to apples. Whenever we do reach that 4-year mark, we could actually see and they be sort of the same language in what we're comparing from this like pre and post, right? So if we could look to integrate similar CASOA language within the survey that has to do with caregiver support that's being kind of administered with these conferences, that would be phenomenal.
That's a great input, Dayton. Also, I think, like there are so many resources that we could cover in a conference, but I think maybe to have a theme for conference and go with the resources around that theme. And then the next year it have a different theme because there are so many directions you could go for caregiver education and resources to support that education and information. That's the thought I would have, but I love that idea, Dayton, about having common language, and that would go throughout for every tactic too.
Yes, agreed.
So then could we take a look at the next one, which is goal number 4, promoting social engagement and inclusion. And so if we're looking at a tactic, if we're looking at resources, possible timeline, and then measuring success. And so Mary, I'm going to let you just kind of maybe, because I think ultimately your tactics are really to actually eventually have some actual events and activities and things that are happening around the region. But do you want to go ahead and throw some thoughts and ideas out from when you and Kathy were meeting? And
yeah, that was like a couple months ago. So jog in my memory. And is Kathy on today? I haven't heard her.
Can you talk louder? We can barely hear
You
you.
can hear me? Can you hear me better?
Yes. No, would you talk, maybe turn up your volume?
Yeah, man, I'm screaming.
Okay. Well, don't wake the children.
That was a long time ago. So I'm gonna try to rack my brain. So I think what we did was the first year was really analyzing and assessing what type of social engagement opportunities are out there. So starting to create this database um, was the first year. So identifying resources and assets was that first year goal. Some of these you can see listed below, like Silver Key, the library, rec centers, right? So looking at resources as places to meet, where are people currently meeting, what's happening at those locations, and the engagement that already exists. So that was really the first year tactics, is creating a database that we can start to log and track what's happening in all these certain communities, and then going from there. Could you hear me?
Yeah, and I'm having Jared scroll up a little bit more to show the year 2, 3, and 4.
Yeah, so then year 2 is after we have this database and we understand the landscape, then we're looking at what barriers are in place that's gonna hold people back for engaging in community activities, socialization, or what's holding back organizations and entities from actually developing programs in place for people to meet. So looking at what is there, what are the barriers? So once we do that data analysis, we could say, okay, there's a community center, and I'm just going to say in Park County, right? And they have this awesome building, but there's no staff to run programs. So we identify what is the need, and then how can we then create a plan then to help them through that barrier to then allow for more programs to exist. So year 2 is identifying those barriers. Year 3 is implementing then change to help fight those barriers. And then year 4, bring people together to actually go to the events, go to the community, and leveraging what assets are already there. So that was kind of Kathy and I's like high level assessing the need. Social engagement is hard to track, right? We learned that with innovations in aging for a domain that's very similar to this. People are meeting each other's homes, right? Neighbors are meeting each other. And so there are things going on that it's hard to be really tangible. But if we look at structures where people meet, park spaces, walkability, right? Neighborhoods, then we can kind of get a feel of what that landscape looks like, and then try to get some momentum through there. I love your guys' input though.
And I'm just going to jump in and say, Mary, I think you and Kathy are excellent people to be putting this together. And I think everything listed there is great and helps me to better understand that year 1 is a tactic, year 2 is a tactic. So that helps me a lot. And then as I'm thinking about how to measure success, I'm just wondering, would this group want to measure success every year? And if we look at what the CASOA is talking about, of course, 3.5 years from now, there can be this idea of, is the community valuing seniors? Do people feel like they're being valued? But I think 2 parts to this. One is, what does success look like for each year with the tactic? And then also, kind of doing a deeper dive, and I can help with this for sure, of kind of trying to tie it back to the CASOA in a way that's meaningful. Because I also just think this is going to get measured kind of differently each year, and not necessarily just being, wondering if the community values seniors, you know what I mean? So anyway. And I see Dayton's got his hand up too, and I know Paula wants to jump in, but.
Go ahead, Paula.
I'm curious if there's a community leaders that will be putting this together, or if it's a volunteer group of these seniors that will be putting this together. Who is leading this? Who is leading this drive to bring these events together? I know volunteers can do it because the Woodland Park Senior Center is completely run with by volunteers. The board is volunteer. There is no paid person in that senior center, and it's running better than it ever did with a paid director. I'm very impressed with that. So I know the right volunteers with the right mindset and the right motivation could pull all of this off. But I just didn't know if there was a community leader per se that would be in charge of all of this. That would be my question.
I had the exact same thought, Paula, in that I'm like, I don't know if it's this group who does a lot of that work. Rather, just as it says in the objective of leveraging the community's unique resources and assets. So I love the idea of that sort of first phase of this tactic, understanding the resources within the communities who are positioned and motivated to do this work, and then really amplifying their message, right? So how do we empower them and kind of build the bridges between like-minded and similar missioned organizations across those communities? So I think if we were to kind of be the bridge builder versus us kind of create the database ourselves, or us kind of do find those funding barriers ourselves, I feel like if we were to kind of foster the collaboration among those organizations who are in their definition and of their communities, building those senses of community, and also maybe putting on workshops. In my mind, that's a big qualifier with this goal. Since, if we're looking at the CASOA data, the work skills piece is really needed attention to. So what organizations are kind of paying attention to that, and how can we as a commission be a bridge builder and also amplify what they're trying to do? Maybe they have an event in mind, pardon me, that we could get the word about out. Sorry, done talking.
And
yeah, I think Kathy and I are on board. Really, when we did this, we were brainstorming, right? I think all of us were really brainstorming what this could look like. So I love all that feedback, and I think that we can't own it. It's not gonna be successful if we own it, but if we can pass along and inspire and come along and support, I think that will be great. So I agree with what's been said.
And I think that this was on the agenda too, as something to talk about today is, tracking and implementing the goals. Do we end up having 4 subcommittees of the Commission on Aging? And so I'll bring this back up again later, at a later moment, but, Dayton, you kind of hinted at it just right there, even looking at the housing piece, in order to really work through these things, does the commission do it as a whole, or will there be work groups that are working on these things? And so I'm going to put that out there right now, but and we'll dig into it here in a few more minutes when we move on, but Dayton already alluded to it. So I wanted to really draw attention to that.
Two thoughts really quick, Melissa, before I started coughing. I wanted to quickly agree with your point around kind of the measures of success. I don't want that to kind of fall through the cracks. I think an effective strategy has clear success measures associated with its tactics. And so on these ones that Mary and Kathy had come up with, I think there's two data sets that can happen concurrently of like, we could ask maybe when we convene those, maybe like a first measure is we identified those community assets or resources that could be leveraged for this objective. That's a milestone in my mind. Like we identified them, we're engaging them. The second in my mind is would they be willing and able to ask and get another sort of baseline measure since this CASOA of how folks are feeling that they're part of the sense of community, or again, use that CASOA language to establish another sort of baseline. And we could do that concurrently with these other sort of things going on of there's X amount of workshops going on that are helping people build a sense of community and equipping them with work skills or opportunities, feeling like they have a sense of purpose. So how many of those workshops are going on in these communities could be another measure that's not exactly like CASOA language, but is going concurrent with the CASOA language. So that's something top of mind measurement wise. The second thing, and I'll stop talking, I'm sorry, is that decision around like work groups or that type of thing. I really think that needs some in-depth conversation, and mainly because to me it's like it affects like governance structure, like it affects the structure of the COA as a whole, because right now we have subcommittees and executive committee and us as a whole. And if we bring in work groups, I think we have to have the understanding of the structure and how information flow is done amongst us.
And so if we go back, and I have Jared scroll back to goal number 1, which is enhancing accessible and affordable healthcare. Again, there's a lot of, which Steve actually called it, rough notes here. I don't know if Amy Mitchell is still on the call too, but what I want to try to get kind of a little bit more specific on here is, I think there is one tactic here, but then if we are going to look at me trying to break it out into resources and measurements and a timeline, I'm kind of hoping to get a little bit more there. And then this too will speak to, again, do we have working groups that are working on these things, or, how will we really go forward to be, building these things out? So, Amy, are you still on the call?
No.
Okay.
Yes, I am. I couldn't unmute. Sorry.
Okay. People get their 5 seconds to go ahead,
got
Amy.
My computer logged in. Sorry about that. I'm in Denver. I want to. Steve wrote these notes, and they're a little cryptic to me. But what we discussed was on item number 1 is frequency of doctor visits, because the more time a person can do more preventative doctor checkups and preventative doctor visits, their health stabilizes and is better than if they wait a long time until something is critical. So we discussed how we could help improve doctor visits with regard to transportation challenges and everything to getting to a doctor. Well, in Park County, we have an ambulance district that actually has a meeting room set up for telehealth. And so we could, and most ambulance districts and actually fire stations are closer to the community. People don't have to drive that far to get to a fire station versus possibly driving as far to get to their physician. So wanted to study the model and do some research and data gathering on, is it feasible to expand that model to where we could have locations host telehealth for seniors, neighborhood locations, and facilitate that is a touch or a visit to a physician for an older Coloradan versus them having to go to a doctor. And we could measure with CASOA on frequency of that doctor interaction. Because Steve was very confident that the frequency of doctor interaction was a higher level of quality of health.
Well, it would rival the doctor visit versus the ER visit, where most of them end up
Right.
90% of the time, 99% of the time.
Exactly.
Then they
go
become
ahead.
frequent flyers.
Right, and you don't get any good continuity of care that way, or any kind of ongoing planning on how to maybe change some lifestyle or do some other things to be able to improve your health. So our plan was data gathering phase 1 on finding what partners within each of the 3 counties would be willing, first of all, have broadband capability. Because that's absolutely necessary. Have facility that could be used, like a private room with broadband and a computer, and willingness. And so we'd have to scour the locations and find out where that is. Now, we may exclude neighborhoods that are near physicians, but that doesn't mean an older Coloradan lives near their doctor, even if there is clinics and everywhere nearby. So we figured if we go through that data gathering phase and find out where, then we could try to set up a model. And I am willing to talk to our now retired ambulance district manager. He's very willing to help figure out how he structured this and help me get information for a plan. And then we could use that frequency of visit as a measuring stick.
Great.
I don't know. What do you guys think?
And Amy, I'm wondering, do you want to do these things all in one year, or do you want to be spreading it out? Like the gathering of the data could be all this next year. And then year 2 is starting to work on establishing a model, that, I mean, do you see that as a more realistic timeline, or doing it all in 1 year?
Well, we can divide it up a couple different ways. We can divide it up and tackle a region, saying where is the highest need. Now, it might be an area where there's no broadband, but we could do it that way and tackle it a region at a time, or we could just do our data gathering and over the whole 3 counties, and then set up the plan. And of course, we'd want to try to execute as quickly as possible. But I think data gathering is going to take a year, because I mean, the 3 counties are huge. I mean, Park County doesn't have that much to go talk to, but El Paso County is a lot of touch points. And
I have a great connection with the Teller County, the ambulance for Teller County. So,
okay. And because these 4 items are they're so diverse. And I mean, we really did pick 4 different goals that will be meaningful. I almost think we're going to need to have maybe just working subgroups at each meeting to try to keep the ball rolling, because there's going to have to be some focus. And I think if we try to have the whole group take care of all of the 4 things at once, we're not going to have enough focus. We've got to have some intense heat. And so I think we could do breakout sessions every meeting for 20 minutes and just go through what have we found, where are we at, who did we make contact with, and maybe go at it that way to be able to make sure that we're focusing in on it every month.
I think that's a great idea, Amy.
And so I have enough information from this conversation to distill down these notes a little bit better. So thank you. And so I can turn it over to Madam Chair to go into our other discussion items unless anyone has a final observation or thought to close out this goals, objectives, and tactics. But otherwise, we can jump into the kind of 3 items that we have to do a little bit more discussion on. These will go relatively quickly. But if anybody doesn't, if there's no more conversation on goals, objectives, tactics, then I can turn it over to Madam Chair.
I'd just like to say, if anyone has any input, wide open to suggestions. Thank you.
Great. We'll move on to discussion items 8A, PPACG board PowerPoint and presentation. Dayton and I will be presenting this Commission on Aging slides at the February, is it the 14th? February 14th PPACG board meeting, where Melissa helped gather all this information, and we critiqued it and narrowed some stuff down, spread some stuff out, and will be a dog and pony show at that meeting. And I think it's going to be good. Do you have all the slides there? Okay, we'll just have Jared go through the slides. First, talk about the mission and vision of the Commission on Aging. Next, then the history of how it started, the statement of work and committees. The next one. What were we going to put on that slide?
I didn't have my microphone on. I'm just telling Paula. So our statement of work is quite long, and so I just need to pull out a couple of core highlighted pieces there and then just list our formal committees.
Thank you. Next. We're going to talk about the facilitated strategic planning that we had with, I forgot her first name, Mrs. Urban. Pat Urban.
There we go.
Sorry, yeah. And she really helped us narrow down our vision, because I can tell you, without her guidance and my initial entrance onto this commission, I was completely lost for the first several months, and Pat really helped us come together as a group and really add cohesiveness and really help us come up with really tactical goals that I just think she really brought us all together and gave us a great vision and mission. I don't know if anybody else wants to say anything about that. But next slide. Then here's where we were going to talk about briefly, not as long as we did tonight, the goals, objectives, and tactics, what we just discussed. And then next. Oh, we are going to go into detail. Yes, we are going to go into detail. But how much time do we have?
I thought it was 15 minutes, 5 minutes for questions. So
Okay,
20
so-
minutes
So
total.
that'll all, as we're the board of directors is actually working out the agenda for February. So we will have that information for you a little bit closer to meeting time, because there are some items that are going before the board which we can't pull off the agenda. So we'll have more details. It may be right up against the week, up against the meeting. So we'll have specifics for you, but keep plugging away with your slides.
All right,
and
great. Yeah,
discussion.
and we
But
can
use
abbreviate.
that as a starting point, because
Yes.
that's what I requested.
And we can
So,
abbreviate as needed
Yeah.
on the spot, right, Dayton? All right, next.
I will say you will not be penalized for brevity with this group.
Okay. And then we have a list of our members and their area of representation. I'm on both Teller County and Colorado Springs because I still feel like I have great connections and collaborations with Teller County, even though I've been away for over a year and a half. So any comments or suggestions or input on that slide presentation? If anyone wants to attend and be in the audience, that would be great. If not, no problem. Dayton and I are just trying to decide what we're going to wear to match, and then then we'll be set. All right,
It looks
next
beautiful.
item. What's that?
It looks great. Good job.
Great. Yeah, thank you, Melissa. Melissa takes most of the credit for all of that, really. We just kind of asked her to move a few things around. So the next one, we've already talked about tracking and implementing goals. The formal PPA COA committee activity and goals, we just touched on that also. So turn the page. Now we are member entity announcements. Does anybody have announcements for the group? No, probably next meeting, possibly. Connie will have an announcement of a new child in her family. Hopefully, that's exciting. And the 10 meeting schedules just lists out the meetings. I have a question about the executive meeting. Did we not move it to 8?
We did. I didn't change it
Okay.
on here.
Okay, so our executive committee meetings are now the first Wednesday of each month at 8 a.m. They are Zoom or in person if you want to come at 8 a.m. to this office, and anyone's welcome to those. You don't have to be a committee chair to be at those meetings, so anyone's welcome to those. And Dayton, your hand is up.
Yep. Thanks, Paula.
Yep.
Yeah, they let me crash the last exec committee, so I invite others to crash the exec committee too. No, I just wanted to quickly make sure that Penny makes her way onto that last slide now that she's been formally voted on. And if we could I'm a format freak, I'm sure you could tell. In those slides, I feel like if we're going to highlight the goals, just formatting those. Happy to help with that, Melissa, if we want to connect before we kind of put the bow on that.
I will. I'll reach out to you.
Thank you. And then lastly, in terms of announcements, public comment for the Colorado's digital access plan ends on the 19th. So if you haven't already had an opportunity to look at the digital access plan, I'm happy to share that with Melissa or just the group overall so you could have a look. They have an online Microsoft form where you can kind of look at the strategies, 6 strategies, and give your input on that in a relatively easy way. So I just think it's important that we all, whether it be as individual citizens and from our personal experience or others in our networks, have an opportunity to have a look at that and give their input, considering the crunch time and the amount of resources behind it. So thought I'd point that out.
Dayton, do you know off the top of your head, is there a website to send people to? Can you type that into the chat? Or
Yep, I'll drop that in now.
And then I can write that down right now and other people can see it as well.
Great. So items for the next meeting. Does anyone have anything that they'd like to see on the agenda for next meeting? We will discuss that at the executive committee meeting on the first Wednesday of February, which is the 7th of February. And if nobody has anything else, I will adjourn our meeting.